My name is Dr. Jason Hochfelder. I'm an orthopedic surgeon with Hudson Valley Bone and Joint Surgeons, as well as Phelps Memorial Hospital. Today we're going to talk about a topic that's very near and dear to my heart, and that's knee injuries. Knee injuries are one of the most common reasons that people seek medical attention, and certainly one of the most common reasons that people walk into my office. Whether you're a weekend warrior or whether you are very athletic and play sports every single day, knee injuries can affect anyone from the very young to the very old and anywhere in between. One of the most common questions that people ask me is, when do I need to seek medical attention for my knee injury? And when can I just try to shrug it off and see if it gets better on its own? It's a very important question, and there's certain signs and symptoms that you can look for that will be a telltale sign that there may be something more serious than just a minor tweak or sprain that you should seek medical attention for right away. First thing is if you cannot put weight on your leg, which means you can't walk without using either crutches or a cane, and you can't walk naturally, then you should certainly seek the attention of a medical doctor or an orthopedic surgeon. If the knee gets very swollen all at once, meaning you twist it and then right away the knee blows up and gets very swollen, that's a sign that there could be a more serious injury and you should seek medical attention. Other things to look for: clicking, catching, any sort of things that we call mechanical symptoms, meaning you feel like something in your knee is getting stuck or like something is catching in the knee. That could be a sign that something inside the knee is torn or could be more serious than just a minor sprain. If the knee feels unstable, meaning you try to put it down and you can put weight on it, but it feels like it's going to give out on you or it's very wobbly, that's another sign that something could be more serious. If you don't have any of these signs or symptoms, then you can certainly try for a few days to see if it gets better. The best things to do, we call it RICE, meaning rest, ice, compression, and elevation. That means take your weight off it, try to elevate it, make sure that it's above the level of your heart. Put ice on it for 30 minutes at a time, which means 30 minutes on, 30 minutes off. Put some compression device, like an ACE wrap, not too tight that it would cut off the circulation, but just so it's a little bit snug to help try to get some swelling out. And if your doctor allows, you can try taking anti-inflammatory medications like Aleve or Advil or Motrin. Even then, if it doesn't get better after a few days, it's not a bad idea just to check in with an orthopedic surgeon or your medical doctor just to make sure there's not a problem. Just to review the concerning signs and symptoms to look for: extreme swelling, not being able to put weight on it, not being able to range it fully, meaning can't get it fully straight or can't get it fully bent, or any signs of instability like you feel wobbly or that's going to give out on you, or any mechanical symptoms like clicking or catching or giving out. These signs you should seek medical attention right away. Otherwise, you can try to rest it and rehab it, as I mentioned before. But even then, if it doesn't get better after a few days, it's not a bad idea to check in with an orthopedic surgeon just to make sure that there's not anything more serious going on.